My name is Dr. Sean Flanagan. I'm an otologist, and essentially what that means is I have an interest and an expertise in the management of hearing loss in both adults and children, and all the associated diseases that affect the ear and the surrounding structures, even the nerves that connect the ear to the brain. My training has been based in Sydney, but I did do some additional training overseas in Italy and came back and set up a practice here in Sydney associated predominantly with St Vincent's Hospital, both public and private. I also consult in Miranda in the Sutherland Shire once a week and have a public appointment at Sutherland Hospital and St George Hospitals, and also operate once a month down at Kareena Hospital as well. Whilst perhaps almost obvious, the importance of hearing is essential from the very beginning of our life until the end. As a young child, speech and language development is essential. As we get through life, it is being part of the community and work and being able to communicate with friends and family. And as we get older, there is certainly a very good correlation between the level of hearing and engagement in the environment and the link with early dementia. So optimising people's hearing is both rewarding and challenging, and certainly very important in what we do. While we manage a vast array of conditions affecting the hearing, there is a small but very important group where the hearing is particularly bad, despite the use of hearing aids, appropriate medical treatment, and even surgical operations sometimes to restore the hearing. Now, these people have been often fitted with hearing aids and work very well with a good audiologist, but nevertheless are unable to hear in an appropriate fashion. Essentially, it's a hearing aid, but it stimulates the nerve of hearing directly. And it is made up of two parts. One, an implantable component that has a very fine electrode that is fed into the cochlea and stimulates the nerve of hearing directly. There is then an external component, and this is essentially the processor or the hearing aid part, and it converts the sound wave into an electrical signal to allow the brain to be stimulated appropriately. Patients with severe inner ear damage affecting the hearing, where a normal hearing aid is really just not providing the appropriate amount of hearing. And people often say, I can hear noise but not speech. I can't talk on the phone anymore. I really struggle to engage in an environment where there's anything more than complete silence. And eventually patients or people describe becoming more and more withdrawn from society because it's just too hard to listen, and thus participate in normal day-to-day activities. So there are a few misnomers. Often patients will say, I'm too old, this is too complicated, the surgery is too risky, it's way too expensive, I can't access that sort of technology. But almost all of these are misnomers, and with appropriate management, these things can be overcome if you are an appropriate candidate for such a device. No longer do we keep cochlear implants purely for patients with no hearing whatsoever. Now, whilst this may sound slightly technical, the advantage of a cochlear implant becomes apparent when we test hearing with hearing aids in, and we ascertain the degree of words correct or sentences that people can understand. And when we are getting to less than 60% or 50% of those words and sentences correct with a really good hearing aid, we know then that a cochlear implant has a very high chance of providing a much better level of hearing. Having said all these things, the decision to proceed to cochlear implantation can be a difficult one. It is a surgical procedure requiring delicate microsurgery, albeit these days, for us, it's a routine procedure. An overnight stay in hospital and the switch on of the implant the following day are now almost routine. The hard work is not mine, however, it is yours. Essentially, this requires an extended period of retraining, working with the audiologist, getting the brain to, and the ear for that matter, to relearn how to hear again. And this may well take a number of months, if not longer, until we really get an idea of how good the improvement in hearing is. One of the important things is working with an audiologist. Now, if your or your child's audiologist is not experienced in cochlear implant mapping, our team here has a vast experience in both the assessment and the ongoing rehabilitation required. So really, the first and most important thing is to truly assess the level of hearing with current technology and medically stabilised ears and hearing. And occasionally this does involve other testing, including MRI scans of the brain and the inner ear, and sometimes even balance testing as part of our medical workup for such an intervention.